All right. Hi, this is Dr. Brig Woods, owner of Polaris PT and Wellness and host of the Professional Spotlight Series. With us today is someone that I deeply respect, and I know you guys get a ton of value from. In fact, I had him fix my elbow when I tore my biceps tendon, and he did a fantastic job. Dr. Doug Clouse is a board certified orthopedic surgeon who specializes in hip and knee preservation and replacement, as well as does other surgeries like my elbow. He's passionate about helping active adults and athletes stay moving for life. And he's built a reputation here in the East Valley for his collaborative approach with both patients and providers. Outside the room, Dr. Clouse is a dedicated family man, an Olympic weightlifting competitor, and he brings that same energy and care to the way he treats his patients. Welcome, Dr. Clouse.
Oh, thank you, man. Very nice of you, man.
Yeah.
You're making me sound too nice, too good, dude.
No, dude, it is all true. Uh, also, congrats on grandpa, dude.
Thank you. Yeah, that's brand new. That was just 2 months ago. She literally hit her 2 month mark yesterday. That's fun.
Yeah, you get the fun part of like, hey,
It is, it is, it's funny because even I kind of, you know, when I've had friends or people who have a new baby, it's like I'm not one to want to really like hold the newborn. That's
oh yeah,
just like, it's fragile. I'm like, it's okay,
yeah,
I'll just wait. And then, but man, when I saw her, I was like, I gotta hold her. Come on, give her to me. Give her to me.
absolutely. Well, it's
You can't get enough of your own grandchild.
somebody told me it was you just get that feeling of what it was like when you had kids, and what it is you don't have to deal with all the extra
That's
stuff.
true. That's true. It's
You're
awesome.
like it's like having my own kid again, but dirty, she
Oh, they're
stinks.
fussy. Oh,
Yeah, yeah.
mom, dad.
Who can I pass them off to? But yeah, man. So that's awesome. So I guess really quickly, like first and foremost, what what really drew you into first, I guess, medicine, and then from medicine, orthopedic surgery?
Um, so actually, it's funny. Is like I remember being in college, and in college, I knew I was going to graduate school. I never remember a time where at what I was like, oh yeah, I'm doing graduate school.
Yeah.
I come from a family of, a lot of professionals, dentists, lawyers, and I'm the youngest, so I had to one up everyone. So I was like, I obviously got to go to med school,
For sure.
but I actually was going to do physical therapy. So I was a pre-physical therapy major is what I was because I knew I
Really?
like that stuff. I've always liked it. And I came home one summer and worked for a doctor, and he kind of just let me follow him around and do things. And I was just like, man, this is real. I just was like, this is so cool. I loved the diagnostic part of it of just trying to figure it out. And I
Yeah.
was like, this is really fun. And he kind of nudged me. He's like, you should consider med school. So I was like, you know what? I think I'm going to go that. And then, um, as I started kind of thinking about it, and I'm a man of faith, and I started doing a lot of prayer. Just I got an answer that that's what I'm supposed to do. So kind of that combination is what when I got that kind of answer, I was like, this is what I'm supposed to do with my life,
That's all. Yeah.
And so, and then when I got into med school, it's kind of funny when you get in med school, there's this, at least when I was at Tulane in New Orleans, which was an awesome school. Loved it. Loved New Orleans.
Go green
But I
waves.
remember when I first showed up, it was kind of almost taboo to say, yeah, I think I want to do orthopedic surgery, because
Really?
immediately that makes you like you're a gunner.
Oh.
You've got to get because it's a competitive residency, so you got to be at the top of your class.
Oh,
And
okay.
so you don't want to come across like, yeah, I'm a surgeon, and people are like, oh man, this guy's a jerk,
Yeah.
So you would always be like, I don't know. And so I knew I kind of liked ortho, but I wasn't sure if that was the path I wanted to go.
Yeah.
And so when I first couple of years, I had a chance to go do all these different rotations. I hung out in the ER. I went to the surgery, into the surgery suite. I was able to spend time with family practice, pediatrics. I did all those things. And what you find is your personality matches a specialty. I mean, and almost to the point where it was a game in med school. You'd be like, you're an ophthalmologist. No, you're a you just their
Sure.
personality just matched it. And literally the first day I did my ortho rotation, I was just sitting around and I was like, all these different residents that I was with, I was like, I would hang out with these guys in a heartbeat. We just everything just clicked, and it was just fun. That's when, sometimes you do rotations and it's just like, I'm getting through this rotation.
Oh
Okay.
yeah. No, I did.
And then,
I did an acute care rotation in the hospital, and I was just like, I'm so glad there's somebody who wants to do this because
Exactly. And then, yeah, then the first day I did ortho, I was like, this is a blast. I love this stuff. And then literally the day I came home that first day and told my wife, I'm like, I'm doing ortho.
that's
And
great.
they never looked back.
That's awesome, man. Was there anybody in particular? I guess that first physician. What was he?
So he was actually a physiatrist. So he did I mean it wasn't quite pain management. He did a lot. He actually did a lot of sports medicine.
Yeah.
His sports medicine a lot had a lot of physical therapy. So he wasn't like a big like tons of injection type guy, but he was just real more in figuring didactic wise. And so that's kind of what drew me to it was that and just his openness to it was awesome.
Yeah. Was there anybody else along the way, like a mentor in particular, that really influenced your path?
Oh yeah, my fellowship director, Dr. Jesse DeLee. So I did sports medicine fellowship,
Okay.
and he wrote the textbook for sports medicine, and so he's a for I did my fellowship in San Antonio, Texas. So he's this Texan. He's awesome. He's just hardest working orthopedic surgeon I've ever come across. Like the hours we put in when I was working with him.
Yeah.
I mean, I put in more hours with him than I did when I was like an intern.
Oh,
I
wow.
mean, he would like start surgeries at 6 a.m. and churn out 3 or 4 total knees or total hips, and then we would run off and get to clinic by 11 or 12 and go to clinic till like 6. And then afterwards, he's like, oh, yeah, we got to do this. And I would have a list of things to do. I mean, it was insane.
Wow.
And it
Because, yeah,
was,
most orthos I know, if they're doing a surgery day, it's just a surgery day and they're
oh,
not going into the clinic.
he packed as much as he could in a 12-hour day. And it was and I mean it's I just loved how he approached everything, how he treated his patients. He's very caring. I mean, he was awesome. And because of that, I've even found like if he was to come into even watch me do surgeries, he would probably be like, that's how I taught you. There's just so many things he taught me that I
Yeah.
still even do today because it works. Like I was like, this technique works.
Yeah.
And so he was very influential on how I do things.
And you said he's super caring. I mean, I noticed. I mean, we have a personal relationship prior, but other people that I have sent over there that they have been to see you, they're always like, yeah, he took more time with me than most orthos take time. I mean,
Yeah.
most orthos, my experience, a lot of them has been like, hey, cool, this is what you got going on. We're gonna need to do surgery, so get you with the scheduler, and yeah, see ya.
Yeah, and I understand that. I mean,
I get it too. I understand it.
and I understand in the way how insurances are and the reimbursement that you're almost forced to
Yeah,
be like, I have to see 20
totally.
patients in a morning. I got to get to 30, 40 patients in a day just to be able to cover all these expenses. It's gotten kind of stupid and kind of silly, and it's I think it's damaged the doctor-patient relationship. And so I've tried to take a different approach. At least when I try to do it, I try to feel like my job is to educate.
Yeah,
Like my job is to say, let me teach you what you have, show you, get it to explain it in a way that the patient goes, oh yeah, oh my gosh, that makes complete sense. You love it when you explain it and they go like, oh my gosh, that explains, what happened last week. And you're like, exactly, you get it. And then be able to just take some time and say, and there is one of the things I feel is like every patient has a unique treatment plan. There
yeah,
is no one, hey, you do physical therapy, you do an injection, you do surgery. That's it. Like I usually try to show, hey, here's a lot of different ways. There's some alternative ways that are open. We don't always just have to go do surgery. Maybe we try some like biologic injections, PRP injections, or try some other things, you know. But that's more a little bit my personal philosophy. That's because I'm interested in that stuff.
for sure.
And so I like to at least provide those options. So I like to consider myself a little bit more of I try to educate people more if I can.
Well, no, and I think that's most people get more buy-in, and I think you'll have better outcomes. That's why you have great outcomes, is because
Yeah.
people bought in and they're on board. For you, when did you realize that this kind of being an orthopedic surgeon or doing what you do had deeper meaning for you beyond just the medical side?
Um, that's a good one. Well, I think I think the fact that like I shared with you that I kind of felt like I had like an answer when I prayed
Yeah.
that this is kind of my path in life.
Yeah,
So I've always kind of viewed that there's a higher purpose for me of just than just this is my job.
for
You
sure.
know, um, there was a time, there was a guy actually a couple times when I just in the last few years, I think during COVID, um, COVID really that was hard for a lot of people. You
Yeah.
know, I mean, for everybody, I remember as physicians, it frustrated me because seeing so many people be able to lack access, we stayed open when we were during COVID just because it was a personal, I was like, we need to. But I remember going through that and the challenges of running a business. I mean, not just being a doctor and
Yeah.
trying to figure out how do we do this and during COVID, but also trying to keep your doors open was
Yeah.
so challenging. And I remember probably a year or two after that, maybe 21, 22, just being just burnt out.
Yeah.
Just like I am just so burnt out. I mean, it wasn't just physician stuff. It was just, yeah, I mean, you're a
Life.
private, yeah, live business owner, and you're like, those
Yeah.
weren't the best of years,
No, they weren't.
Yeah. So those were like tough years, and I remember those being very, very challenging. I remember feeling very burnt out, um, and really having to go back and, there was a time where I was like, okay, why am I doing this?
Yeah.
And really, the only joy I would have in a day would be when I would be able to go into an exam room and shut the door and be with a patient. And
Yeah.
that was it. I didn't have to worry about, hey, here's the report, your end of day report, or here's your finance report. Hey, this bill came in, and how are we going to pay that? Two of my employees are fighting. I've got to go.
Yeah, dude.
I got to go figure that one out. And those times would just be very frustrating. But then the minute you could go into a room and shut the door and just be like, it's just me and my patient. Like those are the times where I realize like this is what I love doing.
Yeah.
I hate going back outside and hearing all the
Yeah.
other stuff. But you have these little tiny moments where you're like, this is awesome. Just connecting with another person and just being able to help them and improve their life. I mean, that brings a quality of just enjoyment of this job. It brings purpose.
Yeah.
Because if it's just like, hey, I saw this number of patients and I was able to collect this amount of money and this, it that doesn't bring a lot of joy, to be honest with you.
No, when you start looking at people just numbers and figures and financial windfall, it's you could be doing anything, but
Mhm.
the humans aspect of it and the connection, but also, yeah, I mean, when I get to see somebody, you change people's lives, man, and when you change somebody's life and you see their face light up and you see that they realize that somebody actually gives a crap about what they're going through, like that's it.
Yeah, it
That's
is.
everything, man.
Yeah.
And I guess to that end, is there any patient success stories, right? You don't have to like identify, HIPAA,
Yeah.
but any patient success stories that have really kind of stayed with you and sort of reinforced why you do what you do.
Um, that's a hard question to some degree because um because honestly, you don't remember your successes.
Yeah.
Honestly, you almost kind of because what we do, I think, for the most part, does bring success. And so a lot of the patients that we see, I almost kind of walk in. I'm expecting success. I'm expecting us to be able to make things
Yeah.
better, improve it. And to be honest with you, that's what we typically see. So you almost kind of forget the successes. Now, I can tell you what I never forget are the complications. Like
100%.
and I wasn't necessarily prepared for that as well as when I came out, that how hard a complication hurts.
Yeah.
And it's not just, I mean, for the patient too, but like if you have a patient that, something happens in surgery, maybe they get an infection or something, like you lie awake at night and you can't sleep. It's hard. And so you never forget those,
Right.
you know. I remember one patient, this was years ago, who I did a hip replacement on and everything seemed to go great in the surgery, no problems. But and she got discharged, but within like a couple of days, she's back in the ER and she's anemic. Looks
Oh my
like, and
gosh.
so we go in, I come into the ER, see her, talk with she gets admitted. We talk to the hospitals. We kind of like, well, it looks like she kind of stabilized. She had to get a little transfusion. We're like, okay, maybe she's a little bit older. maybe just a normal little blood loss, need a little transfusion. She seemed to stabilize, got discharged, and then a couple days later, she's back in the ER. I find myself back in the ER with her. We're trying to figure it out. Like, okay, she obviously has a bleeder. Took her back to the operating room because she's like, there's a bleeder, big old hematoma there, but couldn't find a bleeder, like nowhere. Like searched everywhere. And we're like, what is going on here in this hip? Wash her out, close her up. She's stable for the next several days, and we're like, okay, I guess that was good. She's good to go. Send her home. Sure enough, 4 or 5 days later, she's back.
Oh my
Same
gosh.
thing, blood, levels dropping, and kind of, talking with the hospitals, we finally kind of get a plan and get, interventional radiology involved, which is we talked ourselves out of doing this early on, and I'm kicking myself, but then they did a little scan and found that, yeah, she had a little bleeder that had retracted back into the pelvis. So you couldn't even see it.
Yeah.
And apparently when we did the surgery, the way we positioned her, like it would kind of basically press off the vessel so it wouldn't bleed. There was no
Oh,
bleeding.
yeah.
And so it only occurred when she would either be upright and walking around.
Yeah.
And so we were able to find that, cauterize that, or embolize that, and it took care of it. And she was great, but there was like multiple times of me stressing out, talking with family, going back and forth from the ER, and I just remember I remember that being very frustrating. Like, what is going on with this lady? Why, we're trying to figure out what's going on. But I also remember that she was alone out here. Her daughters lived out of state, and I would always try to, every time I would talk, I would call the daughter. So I called the daughter multiple times, give her an update. And even then, I just remember one time driving home, she was just like just expecting the gratitude of thank you so much for just you caring,
Yeah.
and just, I mean, and to me, I'm just like, I'm just trying to do my job and get her
Yeah.
better. But just that little word just it made me kind of hit me. I remember her specifically, that just kind of hit me, kind of going, wow, yeah, that actually, I was very grateful that she expressed that, because that just really meant a lot to me.
Yeah. Well, and who knows how many other people would have put in the same amount of stress and worry about it and took the time to call the family and keep them updated. You know what I mean? So
Yeah.
yeah, that's great. And to that end, I guess what in your view, I guess what defines exceptional care beyond clinical outcomes?
Hmm.
Outcomes are great.
Well, I mean, I think there's a lot. I mean, there's a lot of good, great physicians here in the Valley. I mean, I know a lot of them. They're really good.
Yeah.
A lot of them are personal friends of mine.
Sure.
I respect a ton of them. Boy, I think obviously it takes a level of just of knowledge and skill. I think that's like a base. You got to have that. You got to be able to be technically able to do surgeries, to not be rushing through a surgery, but just almost having just a very systematic approach to
Yeah.
things. Um, I think that's one level of that of like, for a good orthopedic surgeon, is there is a skill level, and there is varieties of skills that you see. Um, Knowledge base is another one. I think, the other one is boy, that it's kind of a harder, because it's going to be, are you willing to take the time for a patient?
Yeah.
You know, um, because there is a tendency to just get through the day as fast as you can, and sometimes there is a push to, stack a lot of patients up just because there's a demand, and you
Yeah.
end up taking less time. And
You can wait 2 weeks or you can sit in the waiting room for an
yeah.
hour and get a little more time with me.
Yeah. So I mean, I think when you're kind of the times that I felt like I've really provided like really good care has been the times where I've been able to take the time with the patient. I've been able to just sit there and listen to them, really feel like I understand, be able to teach them. I mean, I
Yeah.
love I love to teach. I love to explain things, and but when I've been able to have that and be able to kind of have that valuable time together, where it's not just boom in and out and you're going, like those actually are more meaningful to me.
100%. So kind of moving on to sort of what you do, who you help. I guess what conditions or cases do you most frequently see?
Well, I'm mostly sports medicine,
Okay.
so but that's probably 80% of my practice, is a lot of shoulders and knees. So that means you're dealing with a lot of athletes, soft tissue injuries, tendon tears, ligament tears, meniscus tears, ACL tears. that's probably 80% of my practice is, well, maybe not, maybe 70% of my practice is that.
Hmm.
And then there's the also the because of the need, because people are so active nowadays, sports medicine isn't just the 20-year-old or the teenage 20-year-old. I mean,
Yeah.
sports medicine now is going all the way to your 80-year-old, 90-year-old, to be honest with you, because
Pickleball, baby.
they have, and then you just naturally, because you take care of like knees so much. I do a lot of knee replacements as well.
Yeah.
So it seems like I do kind of yeah, might be maybe 70, 80% of my practice is taking care of some type of shoulder or knee issue. If it's soft tissue, arthroscopic, or knee replacements. And then the other kind of 20% is, I'm going to, I kind of think that once you're kind of part of my patient, like I'll see anything, if you got a
Yeah.
back issue, an elbow, hand, foot, hip, I'll see it. Now, I may not do surgery on everything,
Right.
I at least will see it, evaluate it. If I can treat it, I'll treat it. If you need, if it's a foot case that needs surgery, well, then I'll get you to my buddy that I trust that does great jobs at foot surgery,
Yeah.
and so that's mostly what I do. And then the on the other side of a little bit, I in the last like maybe 4 or 5 years, I've gotten into a little bit more of the regenerative medicine type stuff because it kind of blends well with sports medicine. So PRP injections, stem cell injections, a certain injection called an A2M injection. So there's different types of alternative treatments that there's some people that are just like surgery is not what they want to do, and
Yeah.
so it just at least gives them an alternative treatment option.
That's great. Well, that was going to be something I was going to say. What's something that people misunderstand about your role and specialty when you said sports med is not just your high school or like 20-year-old kid. It's all the way up your 80s now.
Yeah, absolutely. Hey, I'm in my 50s now. I still feel like I'm active and I'm doing stuff. I
Yeah,
need a
man.
sports medicine guy.
Yeah, I hear you. I'm 40. Gosh, I can't believe I'm 43. And I definitely occasionally need a sports med guy. What are some for whatever conditions, or just what are some early warning signs that somebody shouldn't ignore? Like something that's going to be like, hey, you know what? You really shouldn't ignore that. You really should come see somebody like an orthopedic surgeon like yourself.
Probably if something's persistent,
Hmm?
I mean, all of us are gonna like do a little something to our shoulders or knees. Like I'll go work out and do in my training. Yeah, I might do something where my knee will hurt, but a little bit of hey, I've just maybe irritated or flared something up. Okay, a few days, maybe a week, it should kind of be gone,
Yeah.
if it's just something simple. But if I'm like sitting there like, hey, this has been going on for 3 weeks, 4 weeks, it's not going away.
Yeah.
That usually kind of tells you there's something going on. Now, it could be a structural problem of you actually have some tissue damage, or there may be more of a deficit. There's a motor deficit, there's a muscle deficit, there's a weakness, there's a muscle imbalance that you're putting some type of functional stress somewhere that you're not aware of. And so you just keep
Right.
going to the gym, and I see this all the time. Someone may not have some structural damage of their knee, but functionally, and you see this all the
All
time.
the time.
Functionally, you're like, oh my gosh, look at this muscle imbalance. They're not firing this muscle. They're weak here, and so because of that, they're overloading this part of your joint. And then in their mind, they're like, well, I'm going to go to the gym and keep working out. Well, you're working out with these poor mechanics.
Yeah.
So all you're doing is just adding more load
Just
and just
rein,
continuing the cycle.
just
And so, yeah,
reinforcing, the poor mechanics and
yeah.
making it
So
worse.
so that's particularly for stuff like that we see all the time is like, yeah, if you're seeing there's something that's kind of persistent, that's kind of a clue that, hey, something's wrong.
Yeah. Yeah. I would agree with you. Um, so how I guess and to that, yeah. So kind of how does your care complement physical therapy or any other provider, maybe not PT, in kind of do you ever take a multidisciplinary approach?
Oh, okay. You want to hear, I probably have this conversation. You get to be my patient for a second.
Let's do it.
I literally have this conversation multiple times in a day. And it's simply, it's when I try to explain pain to somebody, and
Yeah.
I just say, when I am evaluating somebody, um, and let's say it's someone maybe that's been having pain for a long period of time.
Yeah.
Like I usually ask myself that when I'm looking at their evaluation, it goes, there's four possible causes of your pain that we need to evaluate. The first one is structural. Second one is mechanical.
Right.
Third one is oh, what's um cement, not, no, that's not the word. I just, now you're making me blank on my phrase. I guess I don't say it like that. A systemic. I'm sorry. Yeah.
Yeah.
Third one is systemic, and the last one um is almost kind of like is kind of more kind of a stressors, mental stressors.
Yeah.
Okay. And so we kind of go
Psychosomatic.
through, yeah, yeah. So you kind of look and say, okay, let's look at those four things, because a lot of times someone's diagnosis might have a little bit of everything. And so you need to kind of figure it out. So you say, okay, let's start with structural. Okay. Structural is when there is a structural piece of tissue that's torn. There's tissue damage, and that tissue damage is causing pain.
Yeah.
Okay. And so that's where a lot of times why we do our imaging studies is we're looking for structural damage. That's what the x-rays, that's what the MRIs are going to do. We're seeing, is there a torn rotator cuff tear?
Sure.
Okay. And then because it's torn, that's the source of pain. So that's a structural problem. Now, a mechanical problem is more about how you move. And this is what we're talking about, the motor deficiencies, where you look at, hey, are you weak someplace, tight someplace? The way you're moving is you're putting an abnormal stress. Now, our bodies are meant to be adaptable, but they're only adaptable up to a point.
Right.
And so if we are moving inappropriately, we have a muscle tightness, weakness, we're not doing so, your body's going to be fine, but eventually your body's going to go, all right, enough's enough. You're putting too much stress here. If you keep doing this, it's going to cause a structural problem. So I'm going to cause inflammation, and now you have pain. Okay,
Right.
so there's more of our mechanical. Then you look at kind of your systemic. Is there something else going on in your body? This is where, do you have an inflammatory condition? This is where your rheumatoid arthritis is. This is where maybe your weight. You look at your weight. So maybe someone who has knee or some mild knee osteoarthritis, is their weight putting more load?
Right.
Diet, and so you're looking more kind of the whole body on that person. And then the last one, you kind of look at stressors. Are there stressors in your life? We know that people who have, stressors in their life that are very high, that they can actually manifest it as pain.
Yeah.
Like, someone who has a panic attack has chest pain.
Yeah.
There's structural, there's nothing wrong here, but if you talk to them, they have pain. There's been studies that show that people who are under a lot of stress, when you look at their pain scales on like a musculoskeletal injury, if they're not under stress, it might be like a 3 out of 10, but when they're under stress, it's like a 7 out of 10. You see these
Oh yeah.
changes. So when you're addressing that and you're addressing a problem, you kind of have to look at all four of those issues. Okay. And then you look at them and go, okay, is there stressors? There may or may not be.
Yeah.
Okay. Maybe you look at them and say, hey, with your knee pain, look at, from a systemic standpoint, your weight's an issue here. What can we do about your weight? Now, again, I don't need them to lose 100 pounds, but hey, can we lose 10?
Yeah.
Let's just start small. You look at their mechanical issue and say, you see this muscle imbalance, you see how you're tight here, you're weak here. This is what's causing the problem. This is where my buddy Briggs is going to come into play, and he's going to teach you how to fix this.
Yeah.
Okay. And then you try to educate them and try to help you by saying, this is not going to be easy. This is going to take some time and work. Don't expect a fix in 2 weeks. This may take 6 or 8 weeks, or
Yeah.
even 3 months or 6 months, but be prepared for that.
Yeah.
And then if it's a structural problem, okay, now do I need to be involved? Do I
Sure.
need to go do surgery and fix that structural defect? Do I need to do some type of injection to help that of some kind? So that's kind of how I approach these problems. I just try to look for, like, these are my four factors of pain. Do any of these four factors apply to this patient? And if so, tailor that plan to them. So it's not just, hey, you need surgery because there's a structural problem. It's like, hey, you need surgery, but also this is damaged because of these poor mechanics. So let's get the PT. And you know what? Your weight, or maybe, you have some findings. I think you might have, rheumatoid arthritis. Let's get our rheumatologist involved or something like that. So
Yeah.
you need to approach a problem like that to get the best outcomes. And if you do that, like, you get great results.
100%. Yeah. I mean, and to that end, like, I know that when I'm in a Hashimoto's flare up,
Yeah.
my knees feel worse when I'm trying to do stuff.
100%.
Like,
See, and there's so many times that you just, if you don't take the time and kind of figure that out or talk to them, like, you'll miss that,
yeah.
because you'll be like, oh, your knees flare. Oh, they're inflamed. Oh, obviously it's an arthritic flare. So let's do a cortisone injection and be on your way, when you're like, okay, yeah, but what are you doing to address the Hashimoto's,
Yeah,
let's talk about that for a second.
100%. Well, so if what happens then? I mean, what have you seen? I'm sure you've seen people come in right when they're kind of having an issue, and I'm sure you've seen people delay things to what happens when people wait too long to seek care?
The biggest thing is that you limit your options.
Oh,
I mean,
yeah,
that's the biggest thing is that, if you wait till, let's just do osteoarthritis.
sure.
Okay. Why? Because I have it in my knees. And so I'm dealing with it.
There
Okay.
you go.
So, you have someone, you start having symptoms and you have some mild signs of osteoarthritis. Well, there pretty much everything's on the table for you for treatment.
Yeah,
Physical therapy may be fantastic for you. Maybe if you're having a flare, we need to do a cortisone. Some type of biologic injection may work perfect for you.
yeah,
Um, even maybe even a simpler surgery if we even had to go that. But you just have so many more options.
yeah.
Um, but if of course if you just kind of wait and wait, and when you finally come in, you're like, yeah, your knees just the cartilage is gone. Well,
Straight to the TKA.
yeah, these injections aren't going to work really well. The physical therapy, I don't think works that great when you're like bone on bone, you know. And so yeah, you're talking like our only option may be surgery. Now still a good option, but it limits the patient where they're like, well, I guess this is all I got. So yeah, kind of getting in earlier increases your chance to have a lot of options.
Yeah, yeah, I agree. And it's better to have more options than less. That is
Absolutely.
that is for certain.
Absolutely.
So if somebody was hesitant about reaching out, what would you want them to know?
What do you mean reaching out?
Like reaching out to you to like go get an appointment, like so reaching out to go and seeing like an orthopedic surgeon. What would you want them to know? If they're like, I don't know,
Well, I
nervous.
would say there's you're committing to nothing.
Yeah,
There's no commitment.
right.
You come and see an orthopedic surgeon if someone is the like for example, if I have someone where let's take a spine patient, like I mean I'll see my patients that have spine issues. I help them get diagnosed, but let's say they get to a point where I'm like, this might need surgery. Maybe,
Yeah,
maybe not. I'm not a spine surgeon, so I don't really want to say either way, but I'll talk to him as like, what's the harm in just going and talking to him?
100%.
Having them getting a consult and just having them educate you so that you can make an informed decision. Ultimately, the decision is always the patient's,
Yeah,
but kind of hard to make a decision if you don't have all the information. And if you don't have all the information, the decision you maybe make may be a bad one.
yeah,
So to me, it's like it never hurts to get information.
yeah.
You
Well,
know,
and I think sometimes people are worried. I don't know. I think people are worried about like if surgery or whatever is recommended, almost like disappointing the the provider by like not committing to doing a surgery or like not committing to coming in and seeing us. And I'm like, I, it's your body. Do what you want with
no,
it. I
no,
don't.
no. I mean, I try to approach it in that this is a team.
Yeah,
Like this is a team effort. Like I can give you my opinion of what I think you should do, but if you're not bought in, I don't want to do it. Like if
yeah,
I think, hey, you should do surgery, and the patient's like, I don't want surgery, I don't want to do surgery.
no,
Because I'm just like, oh, if I don't have someone who's like, hey, I'm committed and bought in, then we're good.
yeah. Um, you get got
Okay, sorry.
no. Let's go.
My
No,
staff is telling me
it's all
something.
good. Yeah, no, we're getting close. So just to kind of bring it on home, man. What's the best way for somebody to get in touch with you guys and book an office with your visit or book a visit with your office?
Obviously, you can find us online at azurehealthcare.org.
Okay.
You can also just look in phone number 480-899-4333.
There it is.
So I mean, Google me.
Yeah, it doesn't get any easier than that.
Pretty easy. Just go, you'll find us, and we're here in Chandler, Gilbert area, but we also have an office in Gold Canyon and Maricopa as
Oh,
well. So
nice. I didn't
we
know
have
that.
those three locations. So anybody that's in those locations, come find me.
And then what for first time patient, what should they expect during their initial appointment?
Lots of paperwork.
Yeah. Right.
Sorry, not my choice. Not my
No,
choice.
no, dude, trust me.
Yeah, we just, I mean, it's just, we
Get
just,
mad at your insurance company.
Yeah, we had to implement a new EHR system, electronic medical records today. Today was
Yeah.
day one
Ah,
of a transition. And
oh,
so it's
bless you.
just like, you're just like, oh, I got to redo all these forms. And it's just so painful for everybody. But unfortunately, for the first appointment, that's just the nature of the beast. But
Sure.
other than that, hopefully we can actually, I usually try to block off a little bit extra times, particularly for those first patients, so that we can kind of get to know each other and be able to kind of have a meaningful, like, here's what's going on, here's all your options. And so hopefully can I might overload some people with information
Yeah,
sometimes.
no, I get it. But yeah, that's great. And then any final thoughts for somebody currently silently kind of going about struggling with either shoulder pain or like knee pain, who isn't sure where to start?
Um, I would say I don't think people understand how many options there are for them.
Yeah.
There's a lot of treatment options that we have that don't necessarily involve surgery. I mean, I love doing surgery. It's one of my I became a surgeon for a reason because I love doing it, but I love doing it when it's the right patient at the right time.
Yeah.
Okay, and so that's not everybody.
No.
But there are a lot of options for people, and so if someone is hesitant, then I would say that the main thing would be to come in and at least get get the information. Come in
Yeah.
and at least get the information so you know at least what your options are, because you might be surprised at what things you can do and the things that we can do to help.
Yeah. Well, man, I'm busy, got a lot going on. I appreciate you taking the time in to sit down and tell us more about you, your practice, and kind of why you do what you do. So, yeah, if there's anybody out there that needs or will see somebody about anything they got going on, Dr. Doug Clouse is the man.
Well, thank you, Big Man. You're awesome. Appreciate it.